In S 24 by 7, our goal is to spread awareness and share useful health information with doctors, patients, and caregivers. So we all take better care of our liver health. We are truly honored to have with us Dr. Piyush Marudwar, a well known gastroenterologist from Nagpur. He brings with him 16 years of experience in treating liver and digestive diseases. Dr. Piyush Sir currently practices at Wokat Super Speciality Hospital in Shankar Nagar, Nagpur. He completed his MBBS from Maharashtra University of Health Sciences and later earned his DNB in General Medicine and DNB in Gastro from the National Board of Examinations. Sir, we truly appreciate your time and your dedication to raising awareness about liver health. Without further delay, let's hear from Dr. Piyush sir as he shares his knowledge on this important topic. Over to you, sir.
Thank you for this kind introduction. My, today we are going to discuss about fatty liver and its management. So, good afternoon, all viewers. First, we'll know more about liver. Heart, all of us know how it is important, and awareness about heart diseases is more, but liver diseases awareness is not that much. So liver is one of the most vital organs, and it is one of the largest organ. Its size is around football. Weight is around 1.5 kg. So liver performs more than 500 vital functions, uh, be it digestion, be it synthesis of albumin, clotting factors. It helps in resisting infections. It also helps in synthesis of various enzymes. It detoxifies harmful toxins. So on. Because it is more than 500, so I cannot tell you all functions. Um, so this organ is so important, and it has lot of reserve. So normally only up to 30% of its function is required. 70% is reserved when stress is there. So what happens when fatty liver occurs? So fatty liver means there is a deposition of excess amount of fat in our hepatocytes, that is liver. So normally liver stores fat as a storehouse of energy, but when it becomes excess, then what happens? It gets damaged. Now there are a lot of various reasons for fatty liver. One of the most common reason is MASL, that is previously it used to be called non-alcoholic fatty liver disease. Other causes such as alcohol, viral infections, some of the drugs, metabolic disorders, and sometimes starvation that can cause fatty liver. Today we'll more focus about MASL, that is previously what used to be called NAFLD. So it is metabolic dysfunction associated steatotic liver disease. So when a person does not consume significant alcohol and other etiologies are ruled out, then what we call MASLD. So it is becoming one of the most common cause of fatty liver or liver disease in India. That is because the its risk factors. What are its risk factors? Obesity. Obesity actually in Western world it is BMI more than 30, but in India it is more than 25 kilogram per meter square. That is BMI. What is the unit with which we measure BMI? So if this BMI is more than 25, it is called obese. Person is called obese because in India the harmful fat is more, that is central obesity is more and earlier. So that is why cutoff had to be reduced. Then increased cholesterol. Then what we call diabetes mellitus, type 2 diabetes mellitus, metabolic syndrome. If these risk factors are there, then patient is or person is more likely to develop MASLD. So, and these incidence of these risk factors is increasing. That's why prevalence of the MASLD is increasing. So, MASLD, how it develops? So, initially, what happens? It is a spectrum of disease. For initially, fat gets stored into the liver. When excess amount of fat is stored, then there will be fatty acid. Uh, peroxidation and development of the oxidative stress, which will lead to inflammation, that is swelling of liver, so hepatocytes, and further it gets damaged, and fibrosis, that is scarred, and ultimately that fibrosis stage will go into cirrhosis. So these are the usual stages, or all diseases go, chronic diseases go through these stages. So initially there will be fatty liver, then there will be inflammation and necrosis, and which will get developed into fibrosis, and then cirrhosis. So in the spectrum of disease, some initial stages are reversible. So that is the reason there should be awareness about liver disease. And as I told, only 30% of liver function is required. Rest 70% function is reserved. So until 70% liver gets damaged or significant portion of liver get damaged, the symptoms will not occur. So patient will be unaware of liver disease. So this was about spectrum of diseases. When we go to the symptoms, what are the symptoms which patients get? As I told initially, patient will be asymptomatic. But when patient gets symptom, they can have fatigue, excessive fatigue, loss of appetite. They can have feverish feeling. They can have right upper abdominal discomfort. They can also have pedal edema, abdominal distension when they develop significant damage. They can have bleeding, GI bleeding, such as hematomasis, that is blood vomiting, and melena, that is black tarry stools. If they develop certain complications, they can have altered sensorium, for example, hepatic encephalopathy. Their kidney can also get damaged in complications, that is hepatorenal syndrome. So these are some of the signs and symptoms. Now, when these liver symptoms initially, if you person manifests these symptoms or notices these symptoms, they should uh, consult gastroenterologist. Now, then gastroenterologist evaluate. They do certain tests. So, what are the tests they can do? They will do some blood tests, CBC in this hemoglobin. It can be low because of GI bleed, and there can be mean corpuscular volume can be increased. Uh, then platelet will be low in portal hypertension. LFT, liver function test. Liver function test, there will be AST, ALT, alkaline phosphatase, bilirubin. So these will be altered depending on the what type of liver disease is there. Now, prothrombin time, INR. This is synthetic function of liver. So the if this is deranged, then liver function is not at par, we can say, because the PTINR, these clotting factors determines PTINR, and clotting factors are synthesized in liver. Now then, they will do ultrasound, the sonography of abdomen. In this, initially, the ultrasonographer, they can see how much fat is there. So gradation of fat, depending on how much fat is there, normally 5% of fat can be there. So depending on how much fat is there, they will grade your fatty liver into grade 1 to grade 3 or grade 4. So ultrasound also can see sometimes hepatomegaly if there is swelling of liver, and in later stages they will see if the liver is shrunken. So that is cirrhotic stage. They can also see spleen whether it is enlarged. There is water in the abdomen, that is ascites. Now, next investigation, depending on this data, various the scores are designed. So according to these scores, they will decide which further tests to do or to give treatment. Now there are FIF4, APRI, NFLD fibrosis score, that now it is called MASLD score, MSLD fibrosis score. So if these scores are either they can rule out there is no high risk, then there will be intermediate risk scores, and there will be high risk score. If there is intermediate to high risk score is there, then they will perform further test. For example, they will do transient elastography or MRI elastography. And now, if diagnosis is in doubt, they can do liver biopsy. Now, because liver biopsy is invasive, usually liver biopsy instead of liver biopsy, other non-invasive tests are preferred. But in certain cases, liver biopsy and histopathology is required. So, in non-invasive test for the fibroscan, this transient elastography now it is quite commonly done. So, in transient elastography, uh, what we see, we see how much is the elasticity of liver. The normally it should be less, score should be less than 7. If it is more than 7, so the fibrosis has developed, we can say. Depending on the score, the gradation of fibrosis we can determine. If the score is more than 12, it is significant fibrosis, can be cirrhosis. Now there is cap score, so we can determine how much fat is there. So if the score is less than 216, the usually the fat is F0, that is fibrosis score is F0. So if score is more, then there is more deposition of fat. We can determine. Now MR, MRI scan, kind of MRI scan, it is magnetic resonance elastography. This is another investigations with which we can determine how much fat and fibrosis is there. Now, after deciding the how much fat is there and whether there is fibrosis or not, we can your gastroenterologist will tell you about what to do, how what is the treatment. Now we will come to the treatment. So if so, as I told, there are risk factors such as obesity. So obesity it is very important because obesity is increasing even in children because of the lifestyle change in the lifestyle, sedentary lifestyle, and intake of junk foods, high calorie food. Uh, the incidence and prevalence of obesity is increasing. Now, particularly in India, obesity is defined as, according to the newer guidelines, consensus guidelines, BMI of more than 25 kilogram per meter square. In Western countries, it is more than 30 kilogram per meter square. Why it is so? Because in India, majority deposition of fat is in the central region, that is central obesity. So, which is more harmful fat, so that will damage your liver earlier, that will create more metabolic dysfunction and more uh, metabolic diseases earlier. That is why this cutoff is reduced. So previously what used to be called lean nash, that is BMI is lesser but they are developing liver disease, that is because of this. Now then, high cholesterol should be reduced, that can also cause liver disease. So in obesity, they should reduce weight. If person is obese, they should reduce cholesterol by dietary modifications as well as medication. They will give you statins and other medications. And then also, if there is a uh, metabolic syndrome, that is, it contains hypertension as well. So management of hypertension and other risk factors is also important. Now, person is if a person is consuming alcohol, that will worsen the progression, that is in that it will worsen the progression of disease. So that is why this alcohol and smoking should be stopped. Now also, what in the diet and exercise, particular diet is important. They should avoid junk food, they should avoid high calorie food, processed food such as maida, uh, these sugar, simple sugar should be avoided. And I will always tell the patient, you can eat whatever your grandfather used to eat, because they did not have any packaged food or the junk food. So that is why that food is safe. So our body also requires some fat, but the harmful fat should be reduced, and also excess fat is should be reduced, because you see lot of this the food, junk food and cafes, the lot of cheese is there, so it contains lot of fat, so that should be avoided. And these bakery products also contains lot of calories, simple sugars, that should be avoided. So whatever Packaged food you should avoid that, because that is harmful, and whatever natural food you should eat that. Particularly can have lots of green vegetables, carrots, beans, can have fruits such as apples. They can have the maida. They should not have maida. They should have the ragi, jwar. Uh, these are uh, this contains fibers along with calories. They should have low glycemic index food. Second, we come to this type 2 diabetes mellitus after obesity. Type 2 diabetes should be managed, particularly with the drugs which also helps in liver, such as metformin, pioglitazone, and of course saroglitazar. Saroglitazar, it helps in your diabetes, controlling triglycerides and increasing HDL, as well as improving the liver function and reducing the disease. We'll see in the detail in the later. So this was about reducing the risk factors. Now, what drugs we can use to control the this MASLD, and also to reverse this disease? Now, in lifestyle, we have seen diet as well as exercise. Now, certain drugs such as vitamin E is very useful. Vitamin E can reduce steatosis and reduce the biochemical parameters such as ALT. Now, saroglitazar, it is a novel drug, and it is approved, only drug approved in India for MASLD. What it has shown in trials, it reduces steatosis, it reduces CAP score, it reduces liver stiffness, that is liver fibrosis. That may be because of its use in decreasing the insulin resistance, which will increase the lipolysis, which will reduce fat. So also it helps in reducing the fibrosis. So trials have shown reduction in the 20% reduction in the liver stiffness measurement by transient elastography. But only trials, limited trials are there with the biopsy histopathology. But yes, the whatever it is not harmful, at least whatever the trials have shown, it is the benefit in the reduction in the liver fibrosis. Also, certain drugs to reduce obesity, such as liraglutide, are helpful. And indirectly, metformin also reduces weight and improving insulin resistance. So that will be helpful. So particular help in the MASL, that is only drug which is approved for this condition, is saroglitazar. And the trial was conducted by Zydus. That the brand name is Bielipsa. Now, so this was about what we do with the MASL, this condition, and the other complication which this MASL can cause is hepatocellular cancer. It can cause cirrhosis, which will lead to complication of cirrhosis and liver failure. Now, this will add to the uh, burden of disease, and this will cost patients' lives as well as economic burden to the families. Now, this because of this, liver transplantation has gone up, and much more liver transplants are required. And hepatocellular cancer incidence has gone up. Hepatocellular cancer screening should be done, because the incidence has gone up, and many more cancers are not diagnosed in early stages. That is why mortality has also increased. So this was about MASL. So this is becoming one of the most common condition in India. So because as we have discussed, what are the causes, how it goes into the different stages and spectrum of disease, such as fatty liver, MASH, that is inflammation, then damage, that is fibrosis and cirrhosis, and its complications such as liver failure and hepatocellular cancer. Now, the take home message is improve your lifestyle, because it will cause not only MASLD, it can cause your other metabolic disorders such as MI, the heart attacks, and strokes. Also, take adequate sleep, uh, avoid junk food, packaged food, eat natural food, the green fresh vegetables, fruits, the millets, and avoid high calorie and high fatty food. So, with this, I open the forum. If there are some questions, they can ask.
Thank you so much, sir, for such a clear and informative session. Your guidance has been truly helpful. Now, sir, we have received a few questions from our viewers. So, with your permission, shall we begin?
Yeah. Please begin.
Okay, sir. So, first question coming up is what is the fatty liver disease and how is it different from MASLD?
Yeah. So, fatty liver disease, we can say it is a gross terminology, or it is a condition where there is an increased amount of fat in the liver. So, normally up to 5% fat will be there. If more than 5% of fat is there by its weight, then what we call is fatty liver disease. And MASLD, it's particular condition when there are no other conditions, and also there is no significant intake of alcohol. So when there are increase in the presence of risk factors such as obesity, type 2 diabetes, and dyslipidemia. If this is there and increase amount of fat percentage in the liver, then what we call is MASLD. Previously, non-alcoholic fatty liver disease, it was negative terminology, but with this, we can say we have come to a positive diagnosis. Non-alcoholic means negative diagnosis, alcohol should not be there, and also fatty liver, the stigma was there of fat. So that is why it is a MASLD, that is metabolic dysfunction associated steatotic liver disease. So this is the difference.
Okay, sir. Second question coming up is apart from obesity, what are the common risk factors for fatty liver?
So apart from obesity, common risk factors will be type 2 diabetes mellitus, then dyslipidemia, the high cholesterol level, metabolic syndrome. This is these are the risk factors, and of course genetics. So the Asian population, they are at risk of developing this MASLD.
Okay, sir. Sir, can children or teenagers also develop MASLD and how can parents prevent it?
Yeah, it's a very important question, and because nowadays children are coming with obesity, because of sedentary lifestyle, they are not going to play outside. They are on phone or on the tablets, and their diet is, they are high intake of calories, junk food. They are taking a lot of these chocolates, sugars, these cakes. So because, and then maida, because of this, incidence and prevalence of obesity is increasing in children, and because of that they are getting MASLD. So children also getting MASLD. So this is and its prevalence is increasing.
Okay, sir. Sir, last question coming up is how much weight loss is needed to improve fatty liver?
So more is better. So at least what I tell to the patient, 10% of lose 10% of your weight. So if they lose 10% of it, there will be significant benefit.
Okay, sir. That's all from the question part. So now, sir, on behalf of Nash 24 by 7, we extend our sincere thanks to Dr. Piyush Marudwar for his clear and insightful talk today. Sir, your focus on liver health and raising awareness about fatty liver has truly helped us understand how important timely care and regular checkups are. You have reminded us that with the right steps, this condition can be managed effectively. We also want to thank our wonderful audience for joining us and being so engaged throughout the session. Your support makes programs like these meaningful. Please stay connected with Nash 24 by 7 on Facebook for more updates, expert sessions, and useful health tips. Let's continue to stay informed and take care of our liver, because a healthy liver means a healthier life. Thank you once again, sir, and thank you to all our viewers. Stay safe and stay healthy. Thank you, sir.
Thank you. Thank you.